Delgado. I am the scheduling coordinator here for NJ4S Union Hub. Today we will be having a presentation by Kris Delgado on building a healthier you, the power of preventative care. A little bit about Kris before they do their presentation. Kris is a prevention consultant here with NJ4S Union Hub. She's currently pursuing a master's in public health with a focus on health systems and policy research. Her previous work included working to end the HIV epidemic in Essex County and to foster well-being for the LGBTQ+ community in schools. Kris is passionate about empowering the communities of LGBTQ+, disabled, and survivors of domestic violence, and this passion has changed how they practice public health, especially by focusing on harm reduction, equity for all, and community health interventions and mental health issues. Outside of work, Kris is working on improving her health through strengthening her mind-body connection. This is done by having a movement practice and a mindfulness tea practice. When not focusing on school or her well-being, you will find her trying new recipes or enjoying a book with their cat. Without further ado, I will hand it over to Kris to start their presentation.
Welcome to Building a Healthier You, the Power of Preventative Care. It's important for us to talk about before we even get into any of the important things when it comes to preventative care to see who is getting preventative care. Specifically, when we look at our youth, age 12 to 17, we have noticed a noticeable decline since 2016, when this data started being tracked. And as we go on, we're seeing the numbers get worse and is suspected to continue to go down. And there's a few reasons why people don't, why they won't actively pursue preventative care. Preventative care is very easy to miss. It's believing that you don't need a doctor until you are actively sick, or some people just generally avoid going to the doctor out of fear. Sometimes it's an issue where it's the cost of healthcare, but there's many reasons why people will avoid to go to the doctor or wait till the very last minute. So there's a few things that we want to talk about today. We want to talk about the proactive care pillars. We want to talk about how to overcome barriers. We want to talk about different changes that you can make and what are the next steps to receive preventative care. So there's different types of healthcare. We have proactive, which happens before the illness occurs. It is focusing on long-term health. It is a lower cost and but it does require more effort from the patient. The best way to describe proactive care is, specifically with dental care, is going for routine cleanings. They're able to get in there and make sure that everything is good and prevent any issues that may appear with gingivitis and things like that. Reactive healthcare would be like when you get a cavity or need a filling. So this will happen after symptoms appear. The goal is to diagnose and treat existing issues. It tends to be more expensive, and this tends to be passive of responding to problems rather than proactive and taking care of them beforehand. So there's quite a few consequences for missing preventative care. A lot of people experience a lower quality of life. A lot of health issues have no symptoms until they are severe. Whitney mentioned earlier about my background working in HIV. For a lot of my patients, they would come in 3 to 4 years after they were originally infected because they didn't know what was going on. It was very subtle. They were experiencing allergies or cold symptoms just year round. So a lot of them missed, and it was the last test that they often got. That was something that was very tragic, and helping them get back online and fixing their health was a big passion of mine. That late diagnosis required a lot more aggressive treatment with my patients. We would have to start them out very intense on a lot of medications. They also lose independence of when you don't do the preventative care and you have to constantly going for checkups afterwards, you lose the ability to go do things and not have to check with your doctor previously when you experience a lot more health issues. You have the higher risk of preventable disabilities. People who miss preventative care and experience like health issues may also feel isolated, or they might experience a shorter lifespan due to those health issues. So there's a lot of pros when it comes to preventative care. We have early interventions such as vaccines and screenings, and you are less likely to be hospitalized when you get that preventative care. You're able to have a lot more outpatient experiences and a lot more like doctor's appointment that where you're in there for the day. It's very inconvenient. You get your poked, you get listened to, whole 9 yards, but then afterwards all the issues get addressed. We also have issues around quality of life, of making sure that people can stay active and independent and overall live longer. They also might experience more control. For people who go to like a doctor regularly, they're able to have a better insight on their personal health, and overall they're able to maintain cognitive abilities for longer. So we have a few options for preventative care. We have routine checkups, we have screenings, we have vaccinations, and overall lifestyle and habit changes. So, what to expect during your routine checkup? Think like a physical. This should be happening once a year at minimum. So, they're going to go over your health history. This might include any changes to medications, any like recent injuries. They also might ask about your family history to see if there's anything that they should check for extra. You also have a vital signs check. This often happens, at least for me, before I even see the doctor. I will have a nurse or like a physician assistant come in, take my blood pressure, take my heart rate, take my height, my weight. They also tend to do the history. I also might experience a physical exam of like checking the appearance of my skin, eyes, throat, with the like little light thing. Sometimes they will feel around your like neck and body to make sure your lymph nodes are normal. You also have heart and lungs. They will take a stethoscope and listen to make sure you don't experience any like murmurs, wheezing, or abnormal sounds. They'll check for tenderness, and that will show any like organ enlargement or masses. They'll also check for like reflexes such as balance, coordination. There'll also be more screenings. Like I know for me, after my doctor's appointments, I am sent to like a LabCorp or to do some sort of blood working. So in there they'll check my glucose, my and a lot of different things like that. They'll also often do a mental health screening alongside of it to see if there's any issues going on there, and if an individual needs to be recommended for like further treatment. Also, they'll do personalized advice of like, hey, I am starting a new job. I like, especially specifically with working at HIV, I had to get personal advice of like, oh, don't forget that you like have to make sure that you stay really healthy so you don't accidentally risk infecting any of your patients who had like a weakened immune system. This can also look like, maybe I want to pick up a sport. Do I have approval to do that? Do you think that like this is a good sport or activity for me to do? Everyone should experience a blood pressure screening, mental health screening. They should experience blood tests for cholesterol and diabetes. They should inspect for skin cancer. For a lot of people, and this is something that they'll make a note of in your history, if you have a family history of skin cancer, they'll probably spend more time checking. I know for my friends who like have that very strict, that very like close family history, they might like take a while and examine and mark down like where you experience like freckles and things like that. So when you come later down the line, and if there is a change, they know and they're able to like send you for testing if necessary. We also have things such as hearing and vision. This can be as simple as like covering your eye and like reading out the letters and numbers. This can also look like the little headphones where you raise your hand when there's a beep. For children and teens, specifically young children, they'll check for developmental milestones. Are they like speaking at the right time? How is their like fine motor control? They'll also check for like things like scoliosis, making sure that like the kids' spines are developing like correctly. For adults, they will check for heart disease. A big one for me, given my background, is HIV and Hep C. When we were working on it, when I was working in it, there was a like proposal for legislation of like should HIV testing be considered part of the routine testing, and like me and my coworkers all agreed that that was like the best way to test a lot of people who may not like think that they have a potential of like getting HIV. Some adults can also require genetic testing, whether it's they're choosing to have kids or if they're trying to discover like what health issues that can possibly be going on or what could come up later in life. So we also have vaccines. So these vaccines are able to protect against deadly life-threatening illnesses such as measles, polio, tetanus, or COVID-19. Vaccines are also more likely to reduce complications, where even if you like get a vaccine and you end up getting sick, you're less likely to experience pneumonia from the flu or liver cancer from hepatitis B. It also allows us to protect our vulnerable people who might be around you. I know the Easter and Eid just happened, so I know a lot of people were visiting families, and it's important to protect like all the little ones and anyone else who may be experiencing health issues. And overall, having vaccines make a healthier community, allowing us to like properly be able to go outside and have that energy and have that longer, healthier life. Lastly, we have the thing that everyone dreads is the lifestyle habits. This can look like, at least from your primary care physician, they could be giving advice about like weight loss, recommending specialty diets. If you are suspecting that you might like have a gluten intolerance, they can help you do the screenings and testing for that and like give recommendations on like potential diets. They will also assist with smoking cessation, whether it's an issue of like needing to cut back due to health issues or just personally wanting to stop. They're able to give recommendations of like, here are some programs to try, here are like access. They might recommend things like nicotine patches or like gum to help like deal with withdrawals. um Physical activities, once again, I recently started taking up like Brazilian jiu-jitsu and boxing, and like once I started I was like, oh, this is definitely a sport where you should get cleared by a doctor, because we end up like, not only is it like very intense, there's a lot of physical contact. They can also make referrals to therapy. They can help manage chronic conditions like if you have asthma and things like that. They'll be able to check in and prescribe medications for that if necessary. They'll also talk about preventative habits such as sun protection, making sure you have like the hat, the sunscreen whenever you go out, or oral hygienes of like preventing cavities, plaque buildup, gingivitis. So there are still barriers. For people who experience issues around time, you can try telehealth. Personally, like the switch over to telehealth has been something that like is amazing for me and my health issues, because I am able to like get care and not have to worry about like driving or finding parking. You can also check pharmacy for services if you are unable to like go all the way to your primary care physician for like a flu vaccine. Pharmacies are always able to help, or if you just have any questions about medication. We also have, once again, I will always praise the pharmacists. They are my favorite. They are able to like, you are able to talk to them and ask questions of like, what are potential side effects. The other thing that you can do is attend webinars, specifically ones that focus on, at least for us, on our preventative health, on like what you can do beforehand. Cost, you can find sliding scale clinics. My previous job working in HIV was at one of those. Lastly, you can take advantage of free community screenings. A lot of events tend to have like either nursing students or like student doctors where they'll come do like physical checkups, checking like lungs and like for blood pressure and things like that. Once again, preventative care, prevention saves lives, checkup, screening, and vaccines and habits all matter. And those are the important things to keeping you healthy. It's the little things that go a long way in the long run. Thank you so much for coming and participating.
Thank you so much, Kris, for that presentation. It was very, very informative and a lot for people to take away from. Thank you so much for joining us this afternoon for this presentation. Please join us next week for a presentation by Alex Cadillo on the future of health trends. And also keep a lookout on NJ4S Union socials for the information for next month's webinar series, You Are Not Alone. Thank you, everybody, for joining us today. As always, you can find more about NJ4S on our social media at NJ4S Union. Thank you so much and have a great rest of the day.